Hello to all my wonderful viewers, readers, listeners, my YouTube friends, and everyone out there. Welcome to today's delectable episode of Time Out with Fumi Akingbade, your one and only bedroom instructor. Now, we're going to get the ball rolling. But I need you to know this. You enjoy this more as a couple if your spouse is just right there before you. Because this is the one and the only show that tells you the real things you need to know or hear about sex, sexuality, sexual health, and everything in between. And you know me. My name is Fumi Akingbade, and I guarantee you that we are going to have a marvelous time together. So, on today's show, today's episode, we are going to be answering lots and lots of questions. And in this show, I also want you to know that you can always tell others, subscribe, share, continue to listen, and tell others about everything and tell them about what you've learned and what they can also learn. So we'll continue from where we dropped the last time. If you've not listened to the last video, please go listen to it. The question in the last video is, what is libido and erection? We explained the difference between libido and erection. Now, the next question is asked by a husband. He said, why does a sex look so short? What could be the reason behind a very brief sex? Now, actually, sex shouldn't be brief unless you want it brief. Sex shouldn't be short unless you want it short. Now, this is a question. I always have a brief sex. What could be the reason behind brief sex? Of course, this is another question talking about erection issue, talking about quick ejaculation, talking about weak ejaculation, or one of the issue of erectile dysfunction. I've always told us, erectile dysfunction is an umbrella name, which under it, we have so many. Quick ejaculation, weak erection, erectile dysfunction itself, libido issue, stress, infection, and others. So we are going to take it one after the other. What could be the reason behind brief sex? One of the major reasons in this our generation behind a brief sex is a side effect of masturbation. Now, we're not handling it from the standpoint of the wife or of the woman, but we're actually handling it from the standpoint of the man, because this question came from a man. What could be the reason behind a brief sex? If you are a teenager going up to a young adult and going to be a full adult, please, I will beg you and I will adjure you, do not masturbate. Because there are things that are attached to masturbation that it may eventually take surgery for it to get fixed up. Because the side effect of masturbation is weird. Trust me, when I say weird, it's weird. When a boy child graduates from a child going into his teen, when we talk about teen, we're talking as from 13 to 19. Now, within that space, the body sets itself up for every sexual manifestation in the body of both the girl child going into a teen and the boy child going into a teen. In the boy child, the estrogen, which is a sex hormone, is at full display. It comes as an hormone, and is an hormone, helps to change the vocal cord of the boy child, helps to change the sex organ from a child sex organ to an adult sex organ. You see the pubic hair, the armpit hair, the vocal cord, then the scrotum, the ball, increases in size. Then the penis changes from increase in size, increase in turgidity, and everything. Then every morning, you hear a male child boy say, I had wet dreams. They're actually not an thing, is something to be scared of. Wet dream is just a result of the activity of the testosterone going on in the body of the male child teen in the night. And when this testosterone activity is going on, you will see in his dream, he's dreaming, he's gone, he's sleeping, naturally, the penis gets turgid, the erection just takes place on, and there is an emission of semen out of the system of the male child. Not because he thought of a lady, or he saw a nude picture, or he watched a porn, but because the testosterone is active, ever ready, very active, the hormone is doing its work, changing the boy child to an adult. So when you hear a boy child tells you, I have a wet dream, it's not something you should be scared of. It's not something as a parent you should be scared of. You just need to explain to the boy what had happened. It's the effect of the testosterone. Now, if this boy is not well guided, there's also a feeling of passion towards the opposite sex. There was sometimes years ago, I read about the youngest father who is just 14. He was making sex with another girl. If there's an egg in the girl, there's estrogen and progesterone, there will be baby. So everything that will make him to be an adult is working on. So when that boy child does not think of sex and he experiences that, we call it wet dream. And if you sit him down and explain to him all you need to do, sometimes he sees his panties smear, the boxers smear in the night, just stand up, go clean up, and that's it. And you explain to the boy child, he handles it better. That is the normal sexual effect happening in the nighttime without your own participation. And also, every boy child within that age experience morning erection. When they wake up, or you wake up in the night to go make a pee, you just realize that the penis is turgid. It's very turgid. It's still the effect of the testosterone in the body doing its normal work. That's just the effect. Now, this is the normal occurrences, or sexual occurrences that is acceptable and normal. Now, if there is a teenager who watch porn, who see this, who see that, has unguided passion for sex, for porn, for anything nude, there is a possibility of, it's being lured to masturbation. And masturbation comes in various forms. They may be on their face, lie on their face on the bed, and just try to assume the bed is a female and do assault, or most of the time they use their hands. And this is 90% of many men out there, or young adults that masturbate, use their hand. And this is what happens when you use your hand. I said in the last video that I said libido is different from an erection, that during erection, there's interplay of nerves, neurons, hormones, chemicals, a lot of things. After you've thought about the idea of sex, libido makes you to think about sex. Libido, push you. It's a jump starter. Now, erection brings the activities. It's a physiological. Now, the interplay of all this, and it's going on in the body, and goes through the bloodstream. Now, in the penis is made up of tissue, more of two big tissue, not muscle and not bone. And this tissue has halo, tiny halo, just like the way the lungs had hair sac. There is sac, but there is no hair. It's just an empty sac. And that's why when there is no erection, we say the penis is flaccid. There is this sac, and this sac ought to be filled with blood, little. And during the thought and the process of erection, this sac is filled with blood. Now, when you do masturbate, this is what you do. You use the palm of your hand. Now, the skin of the penis is as soft and tender as the skin of my eyelid. Check your penis. You will see that the skin of your penis is not as tough. It doesn't take something as tough as the back of your hand because it's not exposed to a lot of things out there. Now, this palm is very thick, very thick. Now, this is what happened. When the man takes the teenager, takes the palm of his hand, and now goes to the penis, the skin of this penis is as tender as my eyelid. And now put a force from a harder tissue on a tender tissue, and forcefully now massage the penis to activate the feel of high libido, to activate the feel of erection. Those little tags, box, they just flattens out. They box off. And when you do this over and over, now each tiny of this sac, when they burst out, they become a big hollow one. Besides that, the nerves of the penis is actually immediately after the skin. We have the veins, and we have the arteries, the capillaries. After that, there's so much of nerves. And that's why just a little touch on the penis is alert. So it's loaded with a lot of nerves. Now, these same nerves, because there's a pressure from an outer tissue to a tender one, or pressure. Besides that, the sac is getting busted out. The nerves is getting numbed over and over. If you just start hitting yourself somewhere, you hit yourself every time in that place. After some time, you feel numbness. You don't feel the pain. You've killed the nerves there. So that's what happened. So over the years, the nerves over the penis is numbed. So when there is a feel for wanting to have a feel of libido, wanting to have erection, you've altered the normal psychological interplay of erection. So sex is brief. Why? Those things are becoming a big halo. You don't feel it. And you have a feel. Your libido is intact. Libido has to do with sight, feeling. But erection has to do with your body. But now you've altered the normal cell. And another thing, the vagina is made in a way that it is only the vagina that should home and house the penis, because inside the tissue of the vagina is so soft. It's so soft. The tissue is so soft. It's so succulent. So that when the penis is going in and out, there will be no problem. But now you have used this. Some people even wear some things, some weird things. Some people use towel, some people use all sorts of things, and you damage it. And especially when you are addictively addicted to masturbation, you damage it and damage it and damage it. So when it's now time for real sex, you find yourself lost in the desert of nowhere. Why? Because you've altered the normal physiological makeup of erection. That's number one. Side effect of masturbation. Then untreated sexual transmitted diseases or untreated sexual transmitted infection. Now, I want us to know this. Sexual transmitted infection is not passed alone during sex. If you're used to using intimate stuff with others, there's a possibility of some lingering on those stuff, especially immediately after the person that's infected uses it and you use it. And another way that this sexual transmitted disease comes into our body is most of the time those of us that use sex toys. You use sex toys and you are infected. You don't even have sex with the other fellow, but you're exchanging all sort of sex toy stuff. There's a possibility of you having sexual transmitted disease. And when sexual transmitted disease, the danger of sexual transmitted disease, most of them, is that you don't feel the infection 3-4 weeks after. When sexual STD, any of the STD, gonorrhea, syphilis, this, that, when they come, the only one that you feel immediately, maybe 2 days after, is urinary tract infection. And that's when you have the feel of burning, hotness from the urethra. And that is even a long side effect of any of these sexual transmitted diseases. Women feel it better, the urinary tract infection, faster because of the way their urethra is close to the vagina. And that's the only one. Every other one, and amazingly, women who have sexual transmitted disease, it doesn't even show faster like men. Weeks after, that's when the symptoms start showing in the body of the woman. But in the body of the man, it shows faster, but weeks after. And this is because the same pipe that is a passage for the urine is the same pipe that is a passage for the semen. So, and that's why men easily notice faster, and that's still after many weeks. So when you have unsolicited, hygienic sex anywhere, I will always advise you don't, but if you do, try to look for how you get yourself easily uninfected, because you cannot be sure if you are not infected. And it always lingers on both man and woman. Reason being that it's not easily discovered. And when it's discovered, two things doesn't make it get easily killed. The shame of the father, I have gonorrhea, I have this, I have syphilis, I have this. Oh, why will I, when I get to the doctor, the way the doctor will look at me, whoa. Now, instead of you to go to the people that will first clock you, secondly, go do a test to know which of the STD or STI is affected you. You now go to over the counter. Oh, you read this, you got drugs over the counter, or you go to nearby pharmacy and just get something that you think is what will cure it. You now go over the counter to do that. And now while you're using those treatments on yourself, you're not actually using the best treatment. For any STD to be well cured, first you must be properly clocked, examined, questioned. Then secondly, there must be a lab test to know which of the STI is actually in your body. Now, those two are necessary before treatment. And those are the two things we skip. We skip them to go for treatment. Now, when we go for treatment, because you're treating the wrong STI, it stays with you. It stays in the body. By the time you are now ready to treat them, many of these STI diseases, many of these sexually transmitted diseases are already in our body. And our body tries to fight them, but the residual takes longer. STD takes a long time to leave the system. And because it's in there, it eats up, especially the sexual organs area. Eat up this, eat up that. So side effect of untreated, not properly treated, and not properly treated, or of sexual transmitted disease may lead to brief sex. Now, let me stop with this one. We'll continue on the next episode. This is what could be the reason behind brief sex, part 1. We have part 3. I'm going to stop with this. Sicknesses like hypertension, diabetes, ulcer, long-standing chronic stress, they are causes of brief sex. Now let's look at hypertension. Hypertension itself, because it has to do with blood and because it has to do with blood circulation, there's either something that is narrowing the arteries and capillaries, and the penis of the man need a lot of capillaries for blood transfer. So when this capillaries is blocked or narrowed, the artery and the vein is not properly functioning due to hypertension, high tension of blood flow. Why would there be high tension of blood flow? Because there's an obstruction, hypertension. Now, when this hypertension is on and is going, when you're 30, check your blood pressure. It's needful when you're 30. In those days, they tell you when you're 60, check your blood pressure. Because of the level of stress, because of the level of synthetic drinks, non-organic drinks we take, soft sugar and oil in high dosage, there's a possibility of hypertension occurring at early stage. In fact, we have children in the elementary that is hypertensive because of the food. Now, hypertension, all it does, it affects the artery. And definitely down the lane, the penis takes its own share of the effects. That there's a pressure on the arteries, there's a pressure on the capillaries, there's a pressure, there's a blockage, there's even occlusion, or any of those ones. They affect our erection. And besides, you know, when you have sex, you exert extra energy. A good sex is actually like 20 to 30 minutes of hard workout. Your heart beats 2 to 5% higher than the normal exercise on the treadmill while you're having sex. So when you are having sex, your heart works faster, harder, and intense. When you're having sex, more, between 2 to 5% higher than when you're having your normal treadmill, normal exercise. So the heart is working, is panting, is working hard during sex. Now, when you are hypertensive, now already there is problem. There is occlusion. The arteries is not in its best position. Is having problem, and you are not having sex. You see, there is double wahala for the body. You are giving double work for the heart. Higher work than even when you do a workout. So it affects erection indirectly because the heart is not well taken care of. Now, antihypertensive drugs. You know, doctors will tell you, choose two. Either you lose your erection or you lose your heart. Every antihypertensive drug, they are erection killer. They are erection killer. So these ones, they kill erection. So when you want to have sex, you're thinking the next 15 minutes, I should be glowing, galloping. And the next 3 minutes, you are like, oh my God. It's because of the hypertension and the antihypertensive drug. Same goes to diabetes. Same goes to anti-diabetic drugs. And same goes to stress. What happens in stress is that when there's high level of stress, every system in our body produces acidic medium and environment, which is dangerous, danger signal for the penis, because penis erection thrive best in alkaline condition. So when there's high stress, we see high level of acidic condition. So I tell people, try to rest. Rest and sleep. Rest and sleep. So today, we are stopping here. This is Why is Sex Brief? Part 1. We'll go to part 2. I want you to watch out for the video and subscribe for this. And don't forget, keep your marriage bed hot and nice. And I'll see your one and only bedroom instructor, Fumi Akingbade. Happy viewing and God bless you. Thank you.